You should always go for consultations with a trained health professional. It's non-negotiable.
Yes. We know they talk about shame. Shame is a very big issue when it comes to sexually transmitted infections.
Using condom is very good. It protects you, no doubt. But it cannot protect you from everything. Yes, there are still some doubts. Hi guys, welcome to the Remedy Podcast, where health talk meets real talk. I'm your host, the pharmacist of Benin, your shop plug for health wisdom. And here with me is my co-host,
Pharmacist Perfect.
On today's episode, we'll be talking about the topic, misconception of STI testing. Why you could still be at risk. I heard about a guy that felt like he had an infection, went to run a test, but still, the test came out negative, and he still had that same feeling of the infection.
Wow.
You know how discomforting that could feel?
Yeah.
When you know that there is you don't have any
something, but you can't find out what exactly.
You can't just seem to figure it out.
Yeah. So when you talk about that, right, there is this thing I want Nigerians to understand. So when it comes to STI testing, Nigerians think it's one for all.
Yeah.
You know, once you go to the lab, you tell them you're feeling something, they run a urine MCS. Once the test comes out and you see nothing, it means you don't have an infection.
Yes.
But I don't know, for people watching this, I want to explain it with something, right? Imagine your bank account. Somebody tells you, how much are you worth, right? This is about all the money in all your bank accounts.
Okay.
Now, you open one of your bank accounts, maybe your OP.
Yes.
You open it and you just tell the person 5,000.
Yes.
That doesn't tell the complete picture. Do you get?
Yes.
You have other banks. So you have to open each and every one of those banks and see the accounts and add it up.
Yes.
Exactly. This is the thing with STI testing. When you are looking at something specific, it doesn't tell you that the others are absent. You are searching for this. Imagine going for urine MCS. You're searching for bacteria. So what if it's a viral illness, viral infection that you caught?
That's one thing that people don't get to. You know, sometimes some people just go and run these tests on their own.
Yeah.
They feel like, okay, I'm feeling this way. It must be an STI. And sometimes it's not even an STI.
Exactly.
You know, it could be a UTI.
Yes.
There are different tests you could do. There are viral infections that can give you some symptoms that you are experiencing. But then you might just go and run a test for a bacterial infection.
Exactly.
So,
for you that is telling them UTI and STI, I think you need to explain it better. Because a lot of people confuse that. A lot of people start accusing their partner once the person is dealing with UTI.
Okay.
They happen.
Yes, I understand. So, I'll make it very simple. You know, here we break down those big medical jargons. UTI, now, urinary tract infection. They are different. Sexually transmitted infection is infection when you and your partner, when you meet yourself, and go fit transfer, give each other. Example of those kind of infection now, gonorrhea is one classical example of sexually transmitted infection. Mm-hmm. For UTI, urinary tract infection, example of that one E. coli. Sometimes, for some people to get E. coli, their hygiene, they really matter. The way they wipe when they use the toilets. E. coli, they very safe when they did the rectum, like the anus. But then, when some people wipe from back to front, especially for women, then they carry that E. coli now, come the vagina, for them now, it will come cause infection. So
you are saying for urinary tract infection, it has more to do with their hygiene, it has more to do with their habits, it has more to do with their diet, hormones, all those things. But STI is just from sex.
STI is from sex. Alright. STI is sexually transmitted. I look at it now. STI, sexually transmitted infection.
So at least if you are battling UTI now and your husband or your boyfriend is accusing you, you show him a clip of this podcast and explain to them. So when we are dealing with STI, we must make sure we are not conflicting it with UTI.
No go dey blame your husband for any infection where you get to. Some fit be the one where you give yourself. If you don't know, don't be if it be say you don't go dey do some unhygienic practices wey don give you UTI. You now go feel say oga don go play away match, don carry and give you. Dey careful. You always dey seek advice from professional, medical professional.
But you know the truth. As much as we medical professionals, we say yes, make people come meet us. They should come and talk to us about all these things.
Yes.
We know they talk about shame. Shame is a very big issue when it comes to sexually transmitted infections. Because a guy will get STI, normally, you know, go one open up, if they had them, till it gets to the point where they can't bear it. Imagine you're Instagram influencer or one pen body, you're looking good, sharp, everything is on point, your face, your dress, your sticks, and then you're coming to complain about itching or discharge. People feel shame around those kind of things. They don't know how to open up. They feel it's an indictment on them. That's why I'm hammering on that shame.
Not be like talk, even though say you use big grammar to clear the matter.
Right?
Yes. What you are saying is valid.
Yeah.
But the thing is, I mentioned earlier, when you have issues like this, when you have health issues, you should always go for consultations with a trained health professional. It's non-negotiable because we are trained to be able to handle those kind of issues in a very private manner. We don't share patient information. We don't do that. It's a core training that we have. Right. So you are safe. When you come and meet us, you are very safe. You are safe that your informations are private. Nobody knows you.
And nobody will mock you for
Nobody will mock you. Yeah.
To complain about.
You shouldn't go and meet your pastor. Most people will go and meet their pastor.
Honestly, your pastor is not your consultant. Your pastor is not a healthcare provider. They are after your spiritual needs. We, the healthcare providers, are after your physical needs.
Simple.
Very important. But then again, when we talk about shame, we forget another part. Money. Money. Because these tests are expensive. So I had to get in touch one day with a lab scientist. I was just trying to get the price list of this test.
Yes.
They're expensive for the average Nigerian. So imagine a case where you are telling them to do the VDRL, you are telling them to do urine and MCS, you're telling them to do HBS or whatever test. You're telling them to do like 3 or 4 tests because you want to pinpoint the issue. And the bill is already coming up to 50K. That's close to minimum wage.
That's the issue. That's why most times some doctors are hesitant.
Very.
They cannot just, when they see these patients, they actually want to order this test. In fact, most of them do, actually. Yeah. They don't cut corners. They do, but the patients don't carry out the test. Yeah, because the price is too much and they cannot afford it. True. And that's the problem. Because now you see someone come down with a complaint and the doctor wants to run HIV test, VDRL.
Or some of those things have symptoms.
Yes.
You need to be sure.
Yes. And he cannot, if you don't have money to run this test, most people will be like, I never even run test finish. Yes. See money to run test. How much I'll come take treatment?
Yeah, exactly. So from there, compliance is gone. But, well, since we can't talk in depth about healthcare financing, because that one the fact was plenty, especially in Nigeria that, we're in a low income country.
We are complaining.
Let's try to focus on the ones that we can influence based on education and awareness. People taking ampiclos, for instance. There are some people that will tell you, oh, yeah, give me ampiclos, be charm. I just run one raw, they just have unprotected sex.
Yes.
Once they take down ampiclos, be charm, they feel they are protected against anything. Nothing again where they fear. Nothing.
That's a major issue. See, there is something I always emphasize. I always tell people, know your partner. But then, there is a shortcoming to knowing your partner. You can't always know your partner. 100%. So, man, know thyself. Know yourself.
Well, you need to know that partner.
But you have to know yourself first.
True.
Yes, now. If you don't know yourself, you can't even begin to know your partner.
Exactly.
And knowing yourself means protecting yourself. So you can't start doing medicine after death. You've already done the unprotected sex. You don't know what the patient
Sometimes
has.
the harm has already been done.
Yeah, there are some
Instagram.
Okay.
If you go on Instagram right now, there is a well-known brand, I won't mention name, well-known brand in Nigeria right now. And what they are doing is very dangerous. These people advertise their products in such a way that gives the people idea that once you have raw sex, once you have unprotected sex, you don't need to protect yourself first to just do enjoy yourself. Then after you're done having the sex, you come and meet them and buy the product. The product will protect you from all the infections. I saw it and I was so sad. I was so sad because they are gaining popularity. So they advertise their products in such a way that makes people less likely to even protect themselves in the first place.
That's a problem. That's a problem because now, I just said now, man, know thyself. Yes. And you just counter me that you also have to know your partner. You don't know the kind of infection your partner is carrying.
But can people stick to one partner? That's what we need to.
That's the big. That's
one partner.
That is global. That is global.
Polygamy.
That is global. Like people find it difficult to stick to one partner. People, in fact, in our society these days, sticking to one partner is seen as. I go tell you, say, you know even guy. You know even guy. Yes. How you go get only one babe? There was a time I heard a friend telling me that in Bayelsa, if a man has only one girlfriend, the girls tell him that you know even guy. When girls program, they only get one. When you can have 5.
So we tie our masculinity to the number of sexual partners we have. But here's the problem, right? You're a guy, you have one girl as your major girlfriend, you have a side chick. From those 2 people, you've multiplied it a lot. Your girlfriend has another guy as a side nigga.
Chances of infection.
Your side chick has another person as their main boyfriend. It's multiplying like that. So your chances of infection
like this
is a problem. Is a problem. And if you look at the data right now, some of these sexually transmitted diseases that seemed like we were controlling them well, they are beginning to explode again. The rates. You look at herpes, you look at HPV, you look at HIV, even the one people don't know to focus on, like hepatitis B.
Let me tell you something. Using condom is very good. It protects you, no doubt. But it cannot protect you from everything. Yes, there are still some lapses. Imagine someone with herpes. The person has the lesion. Herpes actually occurs as a lesion. If this thing occurs above where you wear, when you wear the condom, when a man wears a condom, there is a space that you can't cover everything. If herpes lesion appears above that space, and it gets, I know herpes is a contact infection. If it spreads on contact and you have sex with someone and you make contact with that person from that space, you've already transferred. And if you are,
having sex.
No, if you're having sex and there is a period.
Okay, when it's active.
When it's contagious. When you are contagious. If you meet someone at that time, you will transfer that infection, no doubt.
Now that you're talking about herpes, I want to make this plea. Please, Nigerians, stop kissing infant babies on the mouth, on the lips. Please. That whole celebration, you are so happy. They give birth to a new child, you're throwing them up and then you're kissing them on the lips. That's number one way that many people get herpes from. Because herpes is asymptomatic. Sometimes you have it and you never know. Now you're meeting a newborn baby with very low immunity and kissing them on the lips.
Not be just 2 months ago here where I see say they beat person, they want beat and die. I even thought he stole.
Are you serious?
He go kiss person pikin for mouth.
Very important. I don't support violence, but it's very important we discourage people because I don't know why they do it.
It was sad.
It needs to stop. It needs to stop. So at the end of the day, what we're trying to point out are these misconceptions. You know, using ampiclos be charm. Once you use it, you're protected from everything. Once you run one type of test, the other ones are not there because you didn't see anyone with the one you ran. Tests that you didn't even ask a healthcare professional about, you just did it by yourself. You know, all these are misconceptions. So we need people to run tests after consulting a healthcare professional.
Like the healthcare professional should be the one to order the test.
Yes.
Not, you cannot just, you were not trained.
Not because the last time it happened to me, I ran this test. You now go back and repeat the same test.
Don't go and meet your pastor for to complain.
Yeah.
Some people, they think their pastor knows it all. No. When it comes to spirituality, like you just said, meet your pastor. When it comes to health, meet a trained, licensed, very licensed health professional.
And stop listening to the things you see on TikTok and Instagram, feeling that is the right way.
No, yeah, they are good. No, you see TikTok and Instagram, you can get legit information.
But there is a lot of the good and bad.
You have to just streamline. You have to filter it. They are actually professionals on TikTok and Instagram.
If they are following the professionals,
yes, you can follow the professionals. It's not hard to know professionals. They always indicate you will know that this person is a professional.
And once you get the information, also confirm it with your local
the one you can see,
the one you meet up with.
Yeah.
Because this way will eliminate a lot of misconceptions that are leading people into getting these STIs and spreading it further.
So now that I just said this thing, what are the things that people can do to actually limit? Now we have talked about the problem. Yeah. What about the solution? How can they help themselves? How can people help themselves? How can people limit their exposure to the STI?
Alright, so first things first, like you said, meet a healthcare professional. When you're feeling anything, meet a healthcare professional. They will guide you, get to the root. All those tests are not wasteful. They are trying to get to the root of the problem. Because you might take something, you feel it well because it reduced the symptoms, but it did not address the main thing.
True.
That infection will go up, especially in case of women, even for men. You know, sometimes it can cause infertility because you didn't treat it well. It can travel up and then cause PID for women, which is more risky. So all those things need to be treated well. That's the first thing.
Yes.
Secondly, like you said, try to use protection. Very important. I know sex is something that is a taboo in Nigeria. Anytime we hear sex in Nigeria,
not be taboo.
Everybody is like, but we are one of the people that like are very
sexually active.
Do you get? So please use a condom. Using a condom, going to a pharmacy to buy a condom or going to a medical store to get a condom doesn't make you wayward. It makes you responsible. Use a condom, stick to one partner if it's possible. As possible as it can be, try to stick to one partner. The more partners you increase, the more chances of you getting infected with something.
True.
Right? Stick to a partner, try to run tests, even with your partner, like maybe once in 3 months, once in 6 months. And another thing that people do is running HIV tests straight away. You know, you have unprotected tests today, you go tomorrow, run HIV tests.
Now,
it's waste of the money.
You see, some infections, they have an incubation period.
Yes.
You understand?
Yes.
There are some infections that you can acquire now or you can contact now before the microbial load or the viral load
will be enough for you to see
enough, yes, to be able to show in a test. It will take up to 3 months.
Or 6 months.
Yes, 6 months. It takes time. Some can take 3 days.
Yeah.
Less than 3 days. Like like gonorrhea can take less than 3 days. Fine. You've already seen it, or you've already started to even experience the symptom. But you can have HIV taking up to 3 months before the viral load will be large enough.
And you go and do a test and say, oh, it came out negative.
I'm safe, nothing, I'm good. Fine. You know?
Try to run this test on a periodic manner. Consult a healthcare professional. They will tell you the best timing. If you have unprotected sex, don't worry. No trained healthcare professional will judge you or make you feel like a sinner for anything. Talk to them. They will guide you on the right time to run this test and on the right test to run. Right? Hygiene, very important. Because most times the normal infections, the one we call toilet infections, they are not toilet infections. But those kind of infections, the UTIs, urinary tract infections, that are usually based on your hygiene, your hormones, your dressing pattern, a lot of factors, right? Once you have those kind of infections, in certain cases, it increases your chance of getting the sexually transmitted infections.
See the hygiene advice I can give. You see, for women, there are some things you should know about your hygiene. Wiping from front to back and back to front. That is very important.
So which is the right one?
Wiping from front to back. If you wipe from back to front, there are high chances that you carry bacteria from the rectum to the vagina, and that can cause a UTI.
Yeah.
Another one,
UTI, you're increasing your chances of STI.
Simple. In some other cases, wearing latex or very tight fitting undies for an extended period of time, not giving the vagina enough time to breathe.
Very important.
Some people douche.
Some people,
The vagina cleans itself. It cleans itself. So there is no need to douche and think that. Some people also use scented soap.
Yeah.
You know, they just want to wash inside. You don't have to wash inside the vagina. You can wash around the vulva. You cannot make the vagina smell good with soaps. It only
the vagina is not meant to smell like flour.
Simple.
It's an organ. Simple. It's meant to smell natural.
Simple. So when the normal flora in the vagina is okay, when they are okay, when the pH of the vagina is balanced, the vagina will smell lovely. No? Right. So these are the simple. Then always urinate after sex. I can't emphasize this.
Even for the guys.
Especially for the guys. Immediately after sex, just go and urinate. Don't start sleeping like log of wood. Go and urinate.
Please try to use protection, whether you're a lady or a man. You can use the female condoms, you can use the normal condoms. Try to use protection. Don't say, oh, this one is fine, oh, you know, go get anything. You now go raw, unprotected sex.
Don't use it,
use a condom.
Use lubes. Lubes are very important. Water-based lubes.
Because the oil-based lubes can increase your chances of getting infection.
Abrasions during sex. When the
don't shave close to the day.
Don't shave close. Yeah, another thing. Don't shave close to the sex day. When you want to play a match tomorrow, don't start shaving today.
Make it like 2, 3, 4 days before that.
Saves you a lot of trouble.
So we've come to the end of this wonderful episode on the Remedy podcast with my co-host. We've talked about the misconceptions you have about STI, and I hope you enjoyed this episode. We want to tell you thank you, and we hope you enjoyed this episode and you will join us for more interesting episodes. Same time next week.
Your favorite host, Pharmacist of Benin.
The one and only.
One and only.
So, Perfect Rights, obviously. You can follow us on our own individual social media handles. Perfect Rights.
Pharmacist of Benin.
Right. So, subscribe, like, follow, and share this to many people you know still have these misconceptions that would benefit from the information we passed on this podcast. Thank you so much for joining us. See you on the next episode.